This is Dr. Lili with my Pocket Pediatrician. Well, good news is that flu season is long gone and most of the other winter illnesses are off our radar right now. But as summer is in full swing, so is hand, foot, and mouth disease. If you haven't yet experienced this phenomenon, you might be feeling a little bit nervous right now. What is this awful affliction waiting to infect your precious child? Well, just go ahead and watch this quick video and I'll give you all the information you need to make it through this summer illness. Go ahead and just hit that little red subscribe button down there so that you don't miss out on any new content while you're getting ready to learn about hand, foot, and
When the doctor says my child has a condition, I'll learn more at my Pocket Pediatrician.
Hand, foot, and mouth sounds like something horses would get to me. I don't know why, but it just seems like something you should be seeing a vet about, not a pediatrician. However, even if you don't know what it is, it's actually probably something you had as a child. It's a very common, very contagious disease, and it usually makes the rounds every summer. 2 years ago, my neighborhood had a bunch of kiddie pools out at our 4th of July block party. We had all of the toddlers in the neighborhood playing in that pool, pouring water on each other, drinking it, putting toys in it, and 5 days later, every single toddler in the neighborhood had hand, foot, and mouth disease. It can be caused by a number of different viruses, but most commonly we're going to blame Coxsackie virus for it. It typically infects infants and children under the age of 5, but older kids can get it as well. Most of the time adults won't get it, but if they do, they tend to have a little bit more of a severe infection and be a little bit more miserable than the kids who have it. Symptoms typically are going to appear about 3 to 6 days after they've been exposed. The virus is transmitted through saliva and through feces, so sharing drinks, drinking out of the kiddie pool, licking everything and everyone the way that toddlers tend to do, and poor hand hygiene after diaper changes can cause it spread. Typically, children are going to start with fever, sore throat, sometimes a little runny nose. Then they usually get a rash that gives them either small bumps that look like blisters or pimples, usually in and around the mouth, on the fingers, hands, feet. It can also be on the palms and the soles of the feet, and sometimes also around the buttocks. Sometimes we'll see the rash travel up the arms and up the legs, and in some cases the kids wind up with a rash all over the entire body as well. The first few days are usually the worst, and most of the time the symptoms are going to resolve within a week. The blisters that happen in the mouth and on the back of the throat can be very painful. Children frequently don't want to eat or drink when they have hand, foot, and mouth. We usually don't worry too much when kids don't want to eat, but when they don't want to drink, they can actually become fairly dehydrated pretty quickly. Occasionally, they require IV fluids or hospitalization. Sometimes the skin on the fingers and toes or even the palms and soles of the feet will actually peel. Usually it's 1 to 2 weeks after the illness, and that's completely harmless. Every few years, we might get a more virulent strain that can actually cause the fingernails and the toenails to just kind of peel and fall off a few weeks to months later after the illness. This is really alarming to parents, but it's also harmless and the nails will just regrow on their own. I usually try to warn my patients that this might happen so that they don't have to waste another emergency department visit coming back to me, so they can tell me the fingernails fell off and I can just reassure them and send them back home. Hand, foot, and mouth disease is diagnosed with a physical exam from your pediatrician. We can tell based on the physical exam and distinguish it from other causes of sore throat, like strep throat and other viruses. If your child is diagnosed with hand, foot, and mouth disease, you should expect that they're going to be sick for about 5 to 7 days, just like most other viral infections. There is no medication that's going to make it go away faster, since this illness is caused by a virus and antibiotics don't work for viruses. I have another video about why antibiotics don't work for viruses, so if you're curious about that, take a look up there and I'll explain a little bit more. So what can you give your child for pain and fever? We usually just recommend acetaminophen or ibuprofen for pain and fever. If your child doesn't want to drink, I recommend that parents give them a dose of either one of those medications and then wait about 30 to 45 minutes for it to start to work, and then try at that point to try to get the child to drink, because at that point their pain's going to be better controlled and they're going to be more likely to be able to drink. I always tell families to avoid anything too spicy, salty, with too much citrus. Chips and other crunchy foods like that can also be painful on the blisters. So I usually say to try food that's relatively bland, soft, and cool. Things like applesauce, popsicles, sometimes things like pudding or oatmeal can work also. We usually try to eat pretty healthy food in my house, but if my child is sick and they're only going to drink vanilla milkshakes for a couple of days, then that's what we do to get through this illness. It's better to find something that they'll actually drink than to let them get dehydrated and feel even more miserable. For babies who are still drinking from a bottle, that can be pretty painful for them. If they have sores all over their tongue and on the back of their throat, and they have to have that bottle all the way in their mouth and suck on it, they're actually putting a lot of pressure on those sores to get the milk out of the bottle. If that's the case and your child's not wanting to drink from a bottle, in older babies I usually recommend starting a sippy cup so they don't have to put that suction and the pressure on the sores. Or if they're younger, you can actually just take a small syringe, pull up a small amount of liquid, squirt it into the side of their mouth, and just give them a lot of doses of either their formula or breast milk or an oral rehydration solution so that they can get the liquid without sucking and having to hurt their mouths. It can be very time consuming to give several ounces to a baby through a syringe, but that's usually better than having to poke the baby, put an IV in, and then give them IV fluids in the hospital. So if you can syringe feed your baby at home and keep them hydrated, you might save yourself an ER visit or a hospitalization. If you're watching this, you've probably already gone online and Googled hand, foot, and mouth disease, and you're probably going to see something about a wonder drug called Magic Mouthwash. If you're intrigued by this wondrous concoction, it's basically just 2 over-the-counter medications mixed together in a 1-to-1 ratio. Most doctors will give you Benadryl or diphenhydramine mixed with Maalox, which is an antacid. You can mix these 2 together and apply the solution to the sores that are in the mouth. You don't want to put a large amount in there because you don't want the child swallowing it, but you just kind of want to make a coating on those blisters. Studies have actually shown that just ibuprofen or acetaminophen actually works better than the Magic Mouthwash, and it can actually be pretty messy and difficult to apply. I usually recommend that parents start with ibuprofen if the child is older than 6 months, and then if they're still having trouble, to go ahead and try some Magic Mouthwash if they're not getting good enough pain control with the ibuprofen alone. If you do use it though, just use a small amount and dab it on there with either a cotton swab or an oral sponge so that you're just kind of coating the area and not actually having the child swallow large quantities of the medication. In older children, sometimes they actually add another medication called viscous lidocaine, which is a numbing medicine. But viscous lidocaine can be dangerous if swallowed. And again, studies haven't really showed much benefit to having that in there as opposed to just giving acetaminophen or ibuprofen. Some studies have actually shown that there's no benefit to it over placebo. So I don't usually recommend it unless nothing else is working. In some kids, hand, foot, and mouth is very mild, and your pediatrician is really going to have to go hunting for the lesions in order to find them. In other kids, the rash and the symptoms might be very obvious. Sometimes the rash is completely painless, and sometimes it's very painful. The virus changes year to year and from kid to kid. Some years we're seeing a lot of kids who are vomiting with it, and some years we don't see any vomiting at all. Let your pediatrician know if your child isn't able to drink fluids or isn't urinating as much as usual, which is a good way to know if he or she is getting dehydrated. Children are most contagious in the first week, especially when they have a fever. But they can actually continue to shed the virus in their saliva for 1 to 3 weeks after the infection is gone. And this is the part you're going to love. They can actually continue to shed the virus in their stool for a couple of months after the infection is gone. It can be spread through direct person-to-person contact, like kissing or sharing drinks and utensils, or by touching objects that have been infected, like toys that have been put in the mouth. Hand washing is really important throughout the entire year, not just in flu season. If your child has been diagnosed with hand, foot, and mouth disease, does this mean you need to keep them home from daycare or school for the next 2 to 3 months while they continue to shed the virus? Absolutely not. You should tell the child's daycare provider or school, and your child should stay home until he or she has been fever-free for at least 24 hours. You should also consider keeping your child home if they're having a lot of drooling, if they're having a lot of pain and don't want to drink, and they're going to require a lot of your caregiver's time and energy in order to keep them hydrated. Or if they have a lot of open blisters or the care provider feels like they can't adequately care for them without compromising the care of the other children in their care. For example, syringe feeding is very time intensive, and if your daycare provider has got several children to take care of, they're not going to be able to do that for more than one child. These measures aren't going to reduce the spread of hand, foot, and mouth disease because remember, your child is still going to be shedding it for at least 1 to 3 weeks and possibly up to a couple of months after the infection is gone. So your child can still be contagious even if they have absolutely no symptoms. And often they're even contagious before they develop symptoms. You do want to consider keeping them out of swimming pools, especially in the first week or so of the illness, to avoid spreading it to others. While most of these infections are usually mild in children and they recover completely, I do warn parents to keep infected children away from newborns and pregnant women or anyone who might be immunocompromised, such as a cancer patient. The virus can cause much more serious complications in people whose immune systems aren't as strong. Kids can definitely get hand, foot, and mouth more than once. Since viruses mutate, they can have the infection caused by the same virus more than once, or they might have it caused by a different virus. In my experience, the first time is usually the worst, and then they tend to have milder infections in subsequent years. But some years we get a really bad strain, and your child might have a bad infection even if they've already had the virus before. Regardless, the most important thing you can do as a parent is make sure you're keeping your child hydrated, giving them lots of fluids, rest, control their pain with ibuprofen or acetaminophen, control their fever, and just let them kind of recover as their body heals itself. I hope this information has been helpful. I hope it gets you through the next few days of your child's illness. Like I said, if your child isn't drinking anything or seems like they might be dehydrated, if he or she is not urinating well or is acting lethargic, or you have any other concerns, please call your pediatrician or take your child to get immediate medical attention. Otherwise, just keep pushing fluids, control the pain, practice good hand hygiene, and wash your hands frequently, and you should make it through this common childhood illness just fine. Please go ahead and ask any questions you have down below in the comments section. And don't forget to hit that little red subscribe button over there so that you don't miss out whenever I post new content. This is Dr. Lili with My Pocket Pediatrician. Thanks for stopping by.
When the doctor says my child has a condition, I'll learn more at My Pocket Pediatrician.